previous generations, because you speak about it openly. And you have less stigma than our generations have. So I'll start my presentation. Next slide. So, is mental health the same as mental illness? It is the same thing. What about well-being? Is it the same? Mental health, mental well-being. What about happiness? Is mental health tied to happiness? How much money is tied to happiness? Yes. Pesa ni muhimu, eh? So, there's, I don't know if you know this, but there was a task force on mental health in 2019. And it found that Kenyans, including youth, they don't know the difference between mental health, mental illness, mental well-being. Well, they're all the same. But they're different. Are they different? They're different, isn't it? We just don't understand what it entails. Mental health is very broad. It has good mental health and then there's bad mental health or ill mental health. And it's a spectrum. You can't always have like good mental health. So there are days you wake up, you don't want to go to school or you don't want to work. So it happens. It's a spectrum. So sometimes you're up, you're down, your mood changes. So I'll give the definitions. This is just for your own purpose, just to understand. I think we know the definition of mental health. This is a WHO definition. I think we say it everywhere we go. So it's just the ability for you to be able to realize your own ability to cope with the stresses of life, work, and be fruitful in your community. Well-being is a bit different. Well-being is understanding, let me summarize it as understanding yourself. Understanding how you feel. You've heard of self-awareness, yeah? Youth sana wanapenda kuongea about being self-aware. I will take that job, it's toxic. He said, hatukuwa tunajua toxicity ni nini. Our generation, toxicity was like, I don't know, I think we took it as kawaida in the work environment. So I think your generation is more woke than we were. So it's more about how you feel, how you function, at a personal and society level, and also you evaluate your life as a whole. And youth are very vibrant, especially on social media, about how they feel. The only challenge is that Kenyans are not empathic. So you say you're depressed, you're thinking of suicide, what are the comments? What do the comments look like? What are the comments? Are we kind? Do we say we are here for you? There is support if you need support. Do we say that? You remember that incident of that young man in Mombasa who wanted to light himself on fire? What was the crowd saying? Sijui kama nakumbuka hiyo incident. He was a recent graduate, unemployed. And then he set himself ablaze. And no one helped him. People recorded it and said, and he's so young. Akona shida gani? Sio? Is that what your parents tell you also? I think I was told that many times. Nini nakusumbua? Unaishi kwangu? Unakula kwangu? Mimi nakuvalisha? Uko na stress ya nini? Sio? Because that's what we were told us. But at least you guys can stand up and say, mimi niko na stress bado. Whatever way you want to say it. Ask people and say that. So let me go to the next slide. So I want to give you maybe my story of how I got into mental health. The first image is Nasri Hospital, the time I worked there. So I was in Nasri Hospital for 9 years. I was a pharmacist then, I was not in mental health. And I avoided being in mental health. So I chose to work in the CCC. I don't know if you know CCC, the HIV clinic, because I didn't want to see the patients who have mental illnesses. And when I was there, I remember my first posting was Nasri, and I refused to go. I said, I'm not working in Nasri. That was before devolution. So many said, it was before devolution. So we were able to, I wanted to get a transfer. Kenyatta, Bagathi, anywhere but not Nasri. And I think luckily I didn't get that transfer, which is good, because I wouldn't have gotten into mental health. So when I was there, I realized I was very scared of mentally ill patients. I was very scared. I never used to go to the wards. I never used to interact with them. Na ujue nimesoma pharmacy. So nimeenda shule. Nikasoma. And I'm supposed to deal with patients who have mental illness. But there's also a lot of stigma. My mom heard I'm getting my first posting in Madare. Akaita maombi. Akasema it can't be. How are you going to work with people who are mentally unwell? So I tried, I think for a long time, not to work with them. And then I realized those who work in CCC, HIV doesn't kill people anymore, sio? Sisi watu wanasema afadhali HIV kuliko mimba. That's the young generation. HIV doesn't kill anymore. People even have children. So the patients who I had who had HIV and mental illness were doing very well. And I was like, how come these other ones are doing very well? They are virally suppressed. They are healthy. So I came to realize we don't give them the same care. If you've worked in CCC, you know how intense the care is in a HIV clinic. You come in, they take your weight, they take your BP, every visit. They talk to you, there's a counselor waiting for you. You see the doctor, you see the nutritionist. That's every visit. For the mentally ill patients, what was happening is the nurse would come with let me just say a paper, which has their drugs. The patient was not even coming. So they would go straight to the pharmacy and see me and tell me he pays it down. And I'm like, it's for who? Like, Nyamkojo. Because that's the system which was operating before. So she's wondering, huyu msichana mdogo wako 20 something anasumbua kwa nini akili? I want to see the patient. So it became a challenge, and I said, I can't be seeing papers because the ones who don't have mental illness, I see them. So why should I not see the ones with mental illness? So I decided, okay, I need to see them. They're like, oh, but I want to stable, you have to come to the ward. So I had to overcome my fear and go to the ward. It was scary for me at first. I always imagined I'll be attacked, something will happen to me, but nothing ever did for the duration I was there. So when I started seeing these patients, I realized we don't give them the same care. We don't give them the same attention because we think they don't know or they don't understand. Because I know a lot of you here are health professionals. So you will meet in your practice people with mental illness. And what was ironic for me is that one of the, you know how you keep repeating yourself to your clients and your patient, and you're like, meza hii mara mbili mara tatu, make sure usisahau dawa, nini. I kept repeating, and then mgonjwa akaniambia, alikuwa kwa ward, akaniambia daktari, naweza kuwa wazimu lakini mimi si mjinga, nilikuelewa first time you said it. Wacha kurudia sana. These people are smart. They know how we treat them as health professionals. And I think for me, the awakening came when I started going to those wards. Because for a long time, I thought my future is in infectious diseases, HIV care. I never thought I'd get into mental health. I think also what happened is I had a patient. The patient had a substance use problem. He was using substance. He was also HIV positive. And he got TB. So when he got TB, he was already discharged from the hospital. The family brought him to Madare. Because they wanasema nini? Anajifanya. Sio? Ni wazimu tu. And he can't breathe. Because I saw him, he had challenges with breathing, but they're like, you know how you don't trust someone with mental illness and what they say and how they explain themselves. And I told them this guy needs this is physical health now, it's not mental health. He needs to go to a referral, probably take him to Kenyatta, to oxygen needing. And they zunguka within Madare refused to admit him. Because it's not a mental health patient anymore. Then I called the family the next day. You know, he died. And for me, it was like the most unnecessary death because he came when he was able to even stand and be able to explain himself and say, and I told them, this looks like TB, he needs oxygen. So what they did, they took him to Pangani, to a clinic in Pangani. They said they can't manage. By the time they're transferring him to KNH, he died on the way. And he was 38. So I felt like his life was wasted because people decided not to listen to him. Because everything he does is equated to his mental illness or the fact that anatumia madawa. Sio? So there are people in our communities, in our society, in our families, walitumia bangi kitambo, mpaka sasa hivi familia bado inasema, si ndio? Wewe ni mtu wa bangi. Umeleta mambo yako ya bangi hapa. You can't even contribute to the family discussion. Or ulikuwa na depression. You had issues with mental illness, so ulikuwa suicidal. How are you telling us what to do now? So I think for me that's how I got into mental health. And the other side is the new Madari. Madari has really improved from the time when I started working there. And a lot of the improvement is because stigma is a bit going down a bit. Before I would walk into Madari and see patients wanaruka fence, wanakimbizwa na askari, wengine wamefungwa. For me it was very scary. I used to even stand aside nisigongwe, wapite kwanza. Then with years of experience of working in Madari, I became, mimi ndo napigia hata ward in charge. Patient yako ameruka. Ule mtafute. I became, you even lose the empathy. I think it's just to enable us to survive. I stopped feeling like unaenda tu job, unaona wanaruka, unaona wamefungwa. When I used to come, I see the way they are being shackled and dragged. It used to bother me at first. Like, how do they do this to people? With time, mimi mwenyewe nasema hebu fungeni huyo. Mtamshe kando. And it's because you get used to it so much until it becomes normal, but it's not normal. Because imagine if either of us was in that situation, because we can't pursue. And what will our families do? So tutafungwa. They will tie us up, I can tell you for free. And sometimes even get police there. It happens especially to young people who are going to rehab. Unatoa polisi, what will I do? So nitakufungia kwa nyumba. Nitakufungia niende. And a lot of abuses happen then. Because the community knows kuna mtoto amefungiwa hapa, sio? So that is where a lot of GBV happens. A lot of rape happens to those people. Especially if they are very delusional and they are just talking a lot, no one will believe them. Even if they say we ndo ameni-rape, no one will believe you. Atasema aniwekelea huyu mwenyewe ni wazimu. So a lot of abuses happen at that point. Then this, you can see the next one. Go up. This one is actually from one of the villages where I come from. This person, that's where they put him. It's like malioneka uchafu. Because you have a mental illness, hatuwezi kukaa kwa nyumba, you can attack us, utavunja vitu, so you stay there. And then during the day we shackle you there. We go to work, we go graze animals, we do other things, we come for you to work. See? Is that human? Would you want to be in that situation? You know, we always think that it can't be us, see? But at that point, people will make decisions for you. It is not you who's going to make the decision. So we have something called quality rights. I saw it's also in your concept note. It's called the WHO, next, the WHO Quality Rights Initiative. These slides will be shared with you. Please do that course. It's a 14-hour course. You get a WHO certificate at the end. Kenya is implementing it right now. And when you do that course, you realize we take a lot of things for granted, and we take a lot of rights as not rights. I did this course, I failed it in the first time. Because you're like, I hear is a human right. So you know how you choose answers. And to decide where they go to school, to decide where they live, you're like, I use trauma. So families, that's what we do. We decide everything for you. So you realize there's a lot of abuse, especially in African cultures, because we have that tendency of always being the ones who tell you how to live. We want to parent everyone, eh? Hata kazini, we want to be your parents. And I see young people saying that we don't need another parent. Tumeacha wazazi nyumbani. So I'll go now into youth mental health. I think I heard one of the speakers in the morning giving a bit brief. 20% of the youth, that's 1 in 4, 1 in 5. 1 in 5 youth has some form of mental health condition. So that's many. So how many are we here? Maybe 20, 20. So 1 in 5. That's like 5 people, eh? So how many? And we struggle with it every day. And you know why youth and child mental health is very important? 50% of mental health disorders develop by the age of 14. You know how this tendency that we have watoto hawajui where? Ukianza kuongea, even a 9-year-old anakuambia vitu na unajua nini? You are a child. These kids see so much and they get affected. And 75% of mental illnesses develop by the age of 24. That's why in university you'll see, or colleges, students start having breakdowns. Mtu ameingia first year kwa sawa tu. Then anapata breakdown, wengine wana drop the course, they don't finish because of mental health challenges. So that is the time the mental health problems are starting. And then suicide. Suicide is the 4th leading cause of death. That's huge, among 15 to 29-year-olds. And suicide in Kenya, the way we talk about it on social media is really bad. Because sometimes someone posts, wanekata live, sio? Niko kwa hii floor, nataka kujitupa. What do Kenyans say? Jitupe? Wengine wanakuambia tapanda haya, hiyo hapo utapu. Sio? Wengine wanakuambia hapo hata uko karibu sana utaumia. Panda juu. We are so brutal on social media. And that is not helping, because for that person to post, you know, it's a cry for help. They're asking for help. And young people talk a lot about anxiety, depression. Do we seek help for it? Do we seek help? Ama tunaongea tu inaisha. Do we seek help? That college roommate you have, or hallmate you have, mwenye hajatoka kwa room 2-3 days, unaenda kumwangalia? Ama it doesn't concern me, doesn't pay my bills. That's how people find that you have someone even in the same class who dies by suicide and you're all shocked. But then when you start looking back, you're like, oh my God, look at Badidika like 6 months ago. Alianza kwa very isolated, they don't talk to people, they don't come out for activities. So there are a lot of signs this person is depressed, but no one noticed. Next. So there are warning signs I just wanted to highlight. Today I said I don't want to tell you what government is doing. So umesikia hiyo sana. I want to tell you what mental health is for you, so that you can understand it for yourselves. So there are warning signs. Sometimes you have trouble even with doing, just bathing, just getting out of bed, just going to school, it becomes a trouble for you. Your moods are up and down. There are people who we say they're always moody, Wako? Huyo mtu wako moody. Ni hormones, What do you blame it on? Do we talk to them to find out what's going on with them? Or we just say you're just a moody person? We avoid you, Then there is agitation, there is increased abusive behavior, isolation, that's what I talked about. Then there is paranoia. So I think you've heard about being kind. There's always these campaigns about being kind to each other. Kindness really affects a lot of mental well-being of people. Especially people who are in your circle, people who are in your school, people who you're supervising, if you're a manager or a supervisor, people you're working with. So some people can make you leave a very good job, You can be pushed to the wall because isn't it? But I've seen youth, there's a lot of discussion on social media about, there was a youth who was told to come for a job interview, I think it was in Westlands. Akaulizia fare, akaambia kuna fare, akasema sikuchi. You saw that discussion? What did my generation say? They're entitled, unaitwanga hivyo social media. So you guys are going to go into the working life, sindio? So mtamaliza mtaanza job. So that toxic energy that you get there, please do not become part of it. Sometimes it's easier to embrace than to revolt, than to fight it. But I've seen your generation is more vocal and more, I think you stand for what you believe in than we would. Sisi, we are kiss ourselves a lot. I think it's the way we were raised by our parents. But I think your generation, I believe the change in mental health can come from your generation, because you speak even about it. So So I'll go to the social determinants of mental health in young people. This is specifically young people. There's issues of substance use. If there's something I talked about, intergenerational trauma. Is there a time you speak like your mother mpaka unanishikilia? Unasema gai nimekuwa mama yangu. Siko ama nimekuwa baba yangu. You start becoming like them. So there's a lot of trauma we carry from our parents. And they carry from their parents. So it goes from one generation to another. And then issues of HIV. These young people are getting pregnant. See, they're having kids. What are the young people? Teenagers, 9-year-olds, 10-year-olds. Imagine the mental state of that person. Me, I had kids when I was, I think, 25 was my first kid. And it was hard. And I see a 9-year-old pregnant and they're getting kids. I'm like, how do they do it? You know, how is their state of mind really? Because it's a very difficult thing. And then we have some factors are due to society and not individual. Issues of poverty, youth especially unemployment. Unemployment is increasing your vulnerability to mental health problems. And this was found by the task force on mental health. The youth, when they came to talk to the task force, they said the issue is unemployment, give us jobs. Clear off our loans are helps. You know, those were the issues. And gambling. You talked about gambling. They said you need to control gambling and betting because it's taking away a lot of our youth. And then increased expectations of parents in society. Is that a problem? Is that a problem? Ulipelekwa medicine, ukasema uwezi. Ukawekwa wapi engineering, ukasema siwezi. Ukatolewa, ukapelekwa business, ukasema hata istaki. Ukapelekwa wapi? What do you want to do, ukaulizwa? I want to do arts. What will your parents say? Ulipata straight A alliance. For what? It's a challenge. The expectations are so high. And some of our parents are living their dreams through us. Ama? Mimi nilikuwa nataka kuwa daktari. So kupata grades ya daktari. Mtoto wangu akapata A. Nimefanya kuwa daktari. Tunaenda hiyo shule kila siku na wewe. So we are living through us. Because some of these things for them it's for society. Mtoto wangu ni lawyer, mtoto wangu ni daktari, mtoto wangu amefanya hii. For them it's a society thing. But we are not interested in that. I have a close family member. She had a very good job. She did finance, got a good job. First job, 80K a month. So that's good money. Na unaishi kwa wazazi, So very good money. She did it for 3-4 months. She said, I'm not doing it again. Akaacha kazi akakani. Okay, why? And my generation will not understand that. Umeacha kazi ya 80,000. Like that. Like, why? And she doesn't have a job. She doesn't have another job lined up there. She said, I don't want to do finance anymore. But you did 4 years of school in finance. I was not interested in it. I realized I don't like it. What do you want to do? Coding. Okay. You've never done coding. I've never seen you even open a laptop. Naonanga tu ukiwatch movies. You know, that's the rationale as we come with it. I have never seen you having any interest in computers or anything. Okay, how do you want to do the coding? You want to go back to school and learn how to code. What if you're not interested in that? I'll find out nikifika hapo soon. Ni ngumu. Being a parent is hard. It's very hard. And that young person, you will not understand them. That is why young person can only be understood by another young person. Me, I'm not in your generation. So hata mimi najaribu, lakini sijafika level ya kuelewa. You can only be understood by someone in your generation. And they can relate. Can you relate with her? Can you relate with her? Ama mnaona ni responsible? Is it responsible? You relate with that person. Na hata mtamsupport, si ndio? Mimi najaribu kukodi mtu ameka ni mzuri pia sisi tukunje. Sio? So there's also issue of a highly individualized society. And we are losing a lot of our African customs and cultures. Now you can live in a dorm with people and you don't speak to them. Sio? Even in your estate where your parents live, wanaongea na watu siku hizi. Labda the older generation wana kimbele. Unasalimia kila mtu. Even when you want to avoid them, you can't. But our generations are becoming more individualized. Sio? You don't want people knocking your door. Isn't it? And you don't want people talking to your children, Because we're also very paranoid now. Then we have the issues of lack of social support. It is that thing in social media where you have a lot of friends but you don't have any friend. You have a lot of followers but there's none of them is your friend. You're always with people but you're alone. Does that make sense? You're always in crowds but you're alone. You feel very alone. At the end of the day when you go back, you feel very, very much alone. Like you're on your own. But you've always been around people. And then there's new issues that are coming up, or new emerging issues that we have. Cyberbullying. Cyberbullying is a big thing. And it causes a lot of issues of mental health problems. It causes a lot of suicide. It increases the suicide risk among young people. Because when umeamka tu ka post kitu very innocently, people are attacking from all corners, you don't even know them. So, there's one social media, what's it called? Content creator. What are content creators? What's her name? She's always being attacked. Viatu amevaa, ametembeaje, ameenda Dubai. I know you know who it is. Hey, that lady has gone through a lot of cyberbullying. And she's just posting about her life. See, is she posting about anyone else? But people have become very toxic, I think, as a society. So people are always cyberbullying her. And then there's media overstimulation. This is also another challenge. We are always on our phones. If you think you're not addicted to your phone, put it off for 1 week. 1 week, patia mzazi. Mwambie nimesikia, umesema kila siku mimi na hii simu. So our parents are always saying about our phones, Wewe na ile simu yako, utazima wifi. You know, as we didn't have wifi during our time. Sasa mzazi siku hizi kila anafanya anabeba hiyo ruta yote ya wifi anaenda nayo. Seriously. Your generation you can't win, But we are so addicted to social media and our phones. And we watch series for hours and days. I used to do that in uni, honestly. Because I was in a village in Uganda doing pharmacy. There was nothing else to do. But also issue of video games. Sio? Mtu aende class, fees ililipwa, sio? So fees inalipwa. But who knows if you go to school or not? So we have a big problem with overstimulation by the media. Next. So what is the importance of mental well-being of the youth? You'll have a healthier life. You're going to have better physical health. Because if you're not mental, the brain controls everything. If you're not okay here, you can't be okay. That is why you find that you have illnesses in yazina mbele na nyuma. Leo niko na headache, naumwa na mgongo, niko na ulcers, nasikia kutapika, uko na mimba hapana. And that's what your parent asks you, sio? Hii maumivu yote tuende tufanye nini? Pregnancy test, Men, you're lucky, I'm go through such challenges. But you start getting physical problems. Unaambiwa go work out, your parent is like wachana na simu, enda tembea. Do we walk? Hai, kutembea sasa ni by force. Nikinunua gari siwezi. Sasa hivi venye sina gari. Nikibuy gari siwezi tembea. And the old generation would leave their cars in the parking. Sio? Na watatembea. And they would give you the keys, wataenda nayo. And then there's higher education attainment. That's what I was talking about. If bright students, they join college, universities, wanashindwa. And our system of education is also very, can I say it's tough? Because what happens, ulikuwa top KCSE in Kenya. Umekuja class, unapata C, D, you are barely there. Mwalimu anakuambia nini? Wewe hiyo marks ulipata, tunashuku kabisa. Sio? And they even bully you further. And they say, when ulikuwa top issue hii nchi, wewe, when umeshindwa hata kucope na hii course. And a lot of them, the pressure becomes too much for them. And then we have greater productivity, employment, earnings, better relationships. So some of the relationships we say what's squeezy. After God we fear who? Men. Men anasema we fear women, eh? But a lot of it is because mentally we are not okay, eh? A lot of the relationships we are having, sisi wote tuko na childhood traumas tumekuja nazo. Sometimes you become so codependent on someone. You know codependence? You become so clingy mpaka wewe mtu akokai. Sasa wewe nitafanya nini na yeye? Unataka kumfuata kila mahali. Wala kwa doa anawekea GPS. Those who can put GPS in cars they do. You become so clingy. This person akikwambia word moja inakuwa affect hata unashinda kuenda shule. The whole week kwa kitanda. Yeah? It's real, eh? Sio? Because we are not also mentally okay. There's something called emotional intelligence. Umesikia hiyo? It's very important. If you can take a course on emotional intelligence or go for therapy to get emotional intelligence, it is very important. Unajua ile emotional intelligence helps you. You can see your triggers coming from very far. And this person may be a trigger for you, but wewe umeamua umwache. Sio? Lakini ukishawachwa na unasema ni narcissist. I see it on social media. It's definitely a narcissist. Hakuna shida ingine kuna yake is a narcissist. Shida si mimi. But we have a lot of emotional issues. We also have a lot of codependence I feel like as a society. And we are also very scared of failure. Sio? Tambi ulikuwa na huyu tena you hawezi tulia na mtu mmoja. Start thinking you are the problem, eh? So relationships really need people who are also mentally okay. And then social cohesion, engagement, and overall improved quality of life. That photo I took, I'll explain later. The role of youth in mental health. Next. So this, I feel like youth, their role is even more than this. But this is just what I thought about this morning. Advocacy. I can't speak to youth. I can't reach youth the way you can. I can't tell them about mental health the way you could. And a lot of even youth mental health projects, I believe should be designed, developed and led by youth, not wazee. No, I believe it should be led by young people. And that's what Cities Rise does. I think Maureen will speak about that. It's an organization for youth led by youth. Because the way I would design it would be very different. The way my generation or the previous generations will design it would be very different. Me, I would think more of a curriculum, eh? So, I will bring a curriculum in all colleges and universities on mental health, isn't it? Mutende your classes. Eh? Hata labda mnaweza enda kama kuna points I need to get for exams, eh? But who's listening? But me, I've ticked my box, eh? I have reached 1 million students in Kenya with this curriculum. But what is the impact of it? Then also the change makers in mental health are going to be young people. Because you are becoming very innovative, you're using digital technology, you are thinking outside the box. Then public awareness on mental health. You know what happened with the task force? I don't know if you know how it started. For 1 month, youth in Kenya, the former president, they kept harassing him. Let me say harass. I'm not harassed really. But harassing him on social media about what he's doing about mental health for a month. And then the president realized there's a mental health crisis among young people. And he called for the formation of a task force to go around the country and find out what's going on about mental health. So if people tell you social media cannot bring change, it can. And even this story, ID Sumumona, people made news on social media, so you make kando. Social media is a powerful weapon. And then suicide prevention, we need champions. We should talk about suicide. Part suicide because they worry that they'll start putting ideas in your head. So, if your colleague, if your friend, if your classmate dies by suicide, will you talk to your parent about it? Anaweza hata kubadilisha shule. Isn't that such drastic measures we can take as parents? We will remove you from that school. Maybe you should learn the shida. I don't want my child starting getting suicidal thoughts. And then service delivery. Be professionals. Do psychology, do psychiatry, do social work. Go into careers which will help people. Deliver the service yourselves, because you will deliver it better than we would. And then advisors of government, policy advisors, should tell us how they want a school mental health program to look like. Maybe I write something up on the shanga, but I'm trained in that field, but still, I can't meet your needs. Next. So I'll explain the photos I've been showing. Last year, we had the World Suicide Prevention Day, 2023. And if this wasn't an eye-opener for me about youth mental health, we had 2 events. One for youth and one for... Niseme wazee, anaweza kasirika na mimi. Maybe say non-youth then. So the one for the youth, it was difficult for me to get funding for that one. I was very shocked. And I didn't need much money. I needed about 300,000. The one for the non-youth, I needed 2 million, and I got it in 3 days. The one for the youth, I think it took me like a week plus to get that money, and I was shocked that convincing people to give you money for youth mental health is so difficult. So the youth came up with the idea. Maureen is here, the rest are not here. Cities Rise, Alfajiri. I don't know if you've heard of Mizizi Africa. So they came up with the idea, they came with a proposal, they presented it to us and say, we want to commemorate this year's Suicide Prevention Day. It's the highest among youths here. So let us do what we want. Okay, I said, let's write the proposal I see. They want to do it in a cafe in Westlands. Nikasema hii ni noma. Government, we don't in cafes. Nikasema sasa hii nitaconvince aje serikali. How we're going to do it in a cafe. We usually do it in public facilities, public schools. So they said they have a cafe, they've identified in Westlands. Okay, and then we have poets, spoken word, what was spoken word? Spoken word. We have dancers, we have musicians. Then we will have an art wall. I didn't understand it. Wale walijaribu kuniexplainia. Sikuelewa. It's just like, this looks, hi, will you get the youth? We were targeting 250. So they sent a QR code using our ministry website, Twitter. They sent a QR code for people to register. Hi, this one hatutapata. Do you know we filled registration within 4 hours? It was done, and people were calling to ask for more spots, but I didn't budget for the more spots. So I couldn't take up more people. And they were like, we closed registration, we are 250. That's 4 hours. We said, okay. So I went to see the venue the day before. The youth had not set up anything. I came like at 6 o'clock. The event is starting at 8. I was very worried. There was nothing. There were people drinking, there was like people dancing, there was nothing. And I said, oh my God, because my name is on the line. I took up that responsibility and said, I've already gotten funding for this, let them do it. We will be there with them. The youth came, wakaanza kukunywa, wakakaa chini, wakapiga story. Me, I'm just looking at them. Munaanza set up sangapi? Tutaanza, don't worry. I left there, I think around 7. I was so concerned. Nimechukua pesa ya donors. Nishalipia vitu. Actually, I transferred a lot of money to them to buy the things because I didn't understand what they wanted to do. I came in the morning. In the morning, I called them. Hawajafika venue. I called, I think, at 5:30 or 6. I called so early, they were like, "Aye, kunaenda saa hivi." I was so, kumbe they stayed up at night to work on the venue. So me, I came around 7:30. It was set up. And it was set up, I'll show the photos. It was set up, you can see, this is the stage. And then behind, they had like people just seated. Like they just put, it was very casual. And then it had Ministry of Health logo, eh? And some people came with their parents, and the parents were like, "Hii ni event ya Ministry of Health." Nikaambia, "Uko sure?" Niko wakati mimi sasa hata sijui nitasema nini. Let us see how the day progresses, because I've never done such an event before. So they came in, they had a program. Me, I gave opening remarks for like a minute, because the crowd that to the one. People are waiting for those poets and the musicians. Mimi na wastia tu time hapo nikiongea. So they brought the musician, maybe next. They brought dancers. This is the ones on the left are called Mizizi Africa. And they do a lot of ni kuimba ama ni spoken word on mental health, on suicide. And then they have a personal story. So that's why they're very passionate about it. And then you can see this wall they're looking at, the two young people. It was full of memes. It was just memes. Me, I was like, okay, hapa tunafaa kusoma nini? Because I didn't understand. But young people are coming and laughing and going. It was just a wall full of memes. And then they had another wall which was for you write your emotions. You know, as we are not in touch now with our emotions, eh? Ever ask your mom how does she feel? Muliza, how do you feel today? Every morning I'm going to Muliza, how do you feel? We are not in touch with our emotions. You guys know when you are feeling low, when you are feeling okay, when you are feeling depressed, when you are anxious, when you are going through a lot. So the youth wrote a lot of things. And for me, this event really was the most successful event I ever hosted. Because when the youth came in, they were very, let me just say, very enclosed and shelled off, because it's about suicide. Eh? What on a gloomy stories. But one spoken word, the spoken word is a poetry. Spoken word, he talked about when he was in college and he attempted suicide many times in his dorm, and no one noticed. And he talked about the darkness, and now how he's on medication and he's feeling much better. And then, not even a clap after the best spoken word, you don't clap. That's how you see. You see, we have generational differences. Me, I was busy clapping, I was told, "Hey, we know happy." I said, "Oh, okay, we don't clap." So that's why, for me, youth, you are the ones who are supposed to lead this agenda, not us. Because there's no way I would be able to do such an event. My brain would not even conceptualize that. But the youth, it came so easy for them. And they sat down and thought about it and designed it in such an amazing way. You remember the ones who were playing Jenga? Maybe you go back. The other photo. Back. Even this one. They had a place, like they put a bed sheet, I think. Then they got the spray cans, then you write like words of affirmation. And they were writing, and they were spraying. And next, up, just go up. And then they got games. They played Jenga, and for me it was very interesting the way they designed the whole thing. And at the end, people remained. Of course, but they remained and they talked and they met new people and supported each other. The ones who have organizations were able to talk about their organizations, and that was really amazing. Just go back to go down, yeah. Next. So this is the team. Some of them are here. Ana Grace, Nania Papa, so some of them are here, and this was led by young people. us, we just got the money for them, honestly. We just looked for the money and got the Ministry of Health behind it, that's it. But they did an amazing job, amazing. Next, I think that's it. And Red Cross has a line, it's 1199. If you want to call, if you're having issues, if you're having mental health problems, challenges, please reach out. They have counselors on standby. And it's good to talk about it. And I'm happy that your generation is not scared about being labeled as having depression or mental illness or anxiety, as we were very scared. Your parents would even move you to the village hata sijui uko na ugonjwa. Ndio, ukipona ndo utarudishwa. Mtoto anaenda wapi? Alienda boarding school. Alienda wapi? Alisafiri kidogo. They will not talk about it. So, but you are the generation who can change mental health in this country. And I believe that very strongly. So, thank you. Thank you very much.